Now the receptors of sympathetic system are divided into two types, alpha and beta, and alpha 2. Whereas beta are of three types, beta 1, beta 2 and beta 3. So first we will discuss about alpha receptors, then we will move to beta receptors. Now alpha 1 receptor, it is present at three important locations. One, it is present in the blood vessels, and we know that sympathetic system stimulate the cardiovascular system. So blood vessel will be stimulated, that will result in vasoconstriction. So stimulation of alpha 1 result in vasoconstriction, and when vasoconstriction occurs, BP increases. So whenever hypotension is there, we will like to stimulate alpha 1. If there is hypertension, we can treat by blocking alpha 1. Then second important location of alpha 1 is in the eye, and we know that in the eye sympathetic system cause mydriasis. So that is done by alpha 1 receptor. So alpha 1 receptor is responsible for mydriasis. Third important location of alpha 1 is in prostatic urethra, and the function of sympathetic system in prostatic urethra is to decrease the outflow of urine. We know sympathetic system decreases everywhere, so alpha 1 receptor in the prostate help in decreasing the urine outflow. That's why when we block alpha 1, outflow increases, and we can utilize the drug in prostatic condition where urine outflow is less. That is benign hyperplasia of prostate. So these are the three important locations of alpha 1 receptors. Now moving to alpha 2 receptor. Now before discussing alpha 2, we'll discuss that normally we are talking about these receptors. These receptors which are normally producing the action, they are present after the synapse, so also known as post-synaptic receptors. But some receptors are present here also, which are known as presynaptic receptors, and alpha 2 is such a receptor, presynaptic receptor. At most of the places alpha 2 is presynaptic. And if we compare this system with a normal vehicle, in a vehicle we have accelerators and brakes. So these receptors act like accelerator. So whenever we stimulate the receptors, that means we press the accelerator, the vehicle moves forward. So this system is stimulated. But alpha 2 or presynaptic receptor, this act like a brake. That means whenever we press the brake, the vehicle will stop. Similarly, whenever we stimulate alpha 2 receptor, noradrenaline will not come here, so sympathetic activity decreases. So although alpha 2 receptor is a sympathetic receptor, but the major action is to stop the sympathetic activity. Now at some places alpha 2 is present here also, that means postsynaptic, and whenever alpha 2 is present postsynaptically, then its action will be similar to alpha 1. But remember, at postsynaptic places it is very less. Most of the alpha 2 is at presynaptic places. So major function of alpha 2 is to decrease the sympathetic outflow, but if it is present at postsynaptic place, action will be similar to alpha 1. That means if alpha 2 is present in the blood vessel, it will cause vasoconstriction. So this is about the location of alpha receptors. Now we will move to the beta receptor. So three type of beta receptors, beta 1, beta 2 and beta 3. And among these three, beta 3 receptors, they are mainly present in the adipose tissue. Adipose tissue, and stimulation of beta 3 cause lipolysis. And we do not have effective drug which act on beta 3 receptors, and we will not discuss beta 3 anymore. So we will limit our discussion to beta 1 and beta 2. So effectively we will discuss two type of alpha 1, alpha 2, two type of beta 1, beta 2. So we will limit our discussion to these two only, beta 1 and beta 2. Now the location of these two again very easy to remember. We know that we have one heart and two lungs. So beta 1 is in the heart, beta 2 in the lungs. So beta 1 present in the heart and beta 2 present in the lungs. Lungs means bronchus. And we know that sympathetic system stimulate the cardiovascular system. So beta 1 is present in the heart, so it will stimulate. So stimulation of beta 1 cause tachycardia, increase in heart rate, increase in conduction, increase in contraction. Everything will increase. Now second location of beta 1 is juxtaglomerular cells of kidney. Beta 1 receptors are also present in JG cells of kidney, and the major role of JG cells is to release renin. So whenever we stimulate beta 1 in the kidney, there will be release of renin. These are the two important locations of beta 1 receptors, heart and JG cells. And rest everywhere including the lungs, there are beta 2 receptors. Every other place contains beta 2 receptors, like we already discussed about bronchus. Then apart from bronchus, in the GIT, in the urinary bladder, in the uterus, in the blood vessel, in the skeletal muscles, in the liver, everywhere we have beta 2 receptors. Rest every location we have beta 2 receptors. And as we know that beta 1 stimulate the heart, and we know sympathetic system stimulate the heart and depress everywhere else. Everywhere else we have beta 2. So major function of beta 2 will be to relax. So it relaxes the bronchus, resulting in bronchodilation. So in patients of asthma, we will like to stimulate beta 2. We do bronchodilation, we can treat asthma. In the GIT, beta 2 relax, decrease the movement of GIT. In the bladder, beta 2 relax, less outflow of urine. In the uterus, beta 2 relax. So that result in tocolytic action. So in case of preterm labor, where we want to decrease the contraction of uterus, so we can use beta 2 stimulators. Then in the bladder, blood vessel, beta 2 relax, so it results in vasodilation. But we discussed earlier that alpha 1 is causing vasoconstriction. Alpha 1 cause vasoconstriction, beta 2 cause vasodilation. So first, how to remember this, which cause contraction, which cause dilation. So you can remember it easily by remembering ABCD. You all know about ABCD? So 1 and 2, alpha 1 contraction, beta 2 dilation. Alpha 1 cause vasoconstriction and beta 2 cause vasodilation. Okay. Now the next important question is, what will happen to sympathetic blood vessels when sympathetic system is stimulated? Because when sympathetic system is activated, both receptors will be stimulated. So this cause contraction, this cause dilation, then what should be the net effect on the blood vessel? So that will depend upon the number of receptors present. If alpha 1 or more, that blood vessel will contract. If a blood vessel contain more beta 2, that will die. Okay. The next question is, which blood vessel contain more alpha 1? Which contains more beta? Now to remember this, we will assume that sympathetic system is for sympathy of the body. So whenever sympathy is required, sympathetic system will be activated. Now suppose a lion come in front of us, so sympathetic system will be activated. So what we can do at this time? Either we can fight or we can run away. Preferably second option is better. Okay. Now for running away, we will require power in the muscles. And for getting the power in the muscles, they should get more blood. So that means whenever sympathetic system is activated, there should be vasodilations in the muscle. And for getting the vasodilation, they should have more beta 2. So blood vessels of skeletal muscles contain more they contain more beta 2. But important thing is, total amount of blood in the body is limited. If we have 5 liter, it will remain 5 liter. On single line, it will not become 10 liter. So when more is going to the muscles, the other areas will get less blood. So why they get less blood? Because they contain more alpha 1. The blood vessels they contract. Like in the skin, internal organs. At the time of emergency, we do not require blood in skin or internal organs. So those blood vessels contain more alpha 1. So sympathetic system is activated, vasoconstriction occurs. The blood of these areas are diverted to the muscles and the muscles can do more. Okay. So blood vessel, beta 2 or more, they cause vasodilation in the muscles. Whereas at other places, we have more alpha 1 that cause vasoconstriction. Okay. The next is skeletal muscles. So when we stimulate beta 2 in the skeletal muscles, they are particularly present on the muscle spindle. So that will result in tremors. As you all know, whenever sympathetic excess is there, there is development of tremor. Like on single line 12, tremor develop because sympathetic activity increases. In Viva exams, tremor develop because sympathetic system is activated. While proposing a girl, sympathetic system is activated, tremor develop. So all of these because beta 2 cause tremors. The last but not the least, liver. Now before discussing the liver, we will discuss what is more dangerous, hypoglycemia or hyperglycemia. Hypoglycemia definitely, because hyperglycemia means diabetes. There are a lot of patients you must have seen, blood sugar is 400, but still they are alive for 10-20 years. Only thing is they will develop some complications. But if hypoglycemia occurs, only for 1 minute the person will go to coma. Because brain do not get glucose, it do not work, person go to coma. So that means hypoglycemia is an emergency. And whenever hypoglycemia occurs, we require sympathy. So sympathetic system will be activated and sympathetic system will try to protect from hypoglycemia. Now it has two mechanisms to protect from hypoglycemia. One, it stimulates the beta 1 receptors that will cause the stimulation of heart. So tachycardia, palpitation occurs. Second, it stimulates the beta 2, that will stimulate the muscles, tremors occur. So whenever a person of diabetes or person taking anti-diabetic drug, that will tremor, palpitations, that should be sure that the person is having hypoglycemia. Okay? And we already know that whenever sympathetic system is overactive, that sympathetic cholinergic fiber in the sweat gland are stimulated, that will result in sweat. So tachycardia, palpitation, tremors and sweating, they are important symptoms of hypoglycemia. Sometimes also known as warning symptoms of hypoglycemia. So whenever hypoglycemia occurs, it tells that I am present. Okay? So tachycardia, palpitation, tremors and sweating, that is the symptoms of hypoglycemia. So every patient who is diabetic or taking anti-diabetic drug must be cautioned that whenever these symptoms occur, take the sugar. If the person take the sugar, blood glucose increases, then hypoglycemia. Other thing, even then increase in blood sugar slightly, that will not damage anything. Like if blood sugar is 60, it become 100, that will protect the person. But if it is 500, it become 540, that will not damage anything. Yeah? So a person should take biscuit or sugar whenever hypoglycemic symptoms occur. Suppose the person is not aware of these symptoms, person do not take sugar, hypoglycemia is present, still the body try to protect. Now it protect by stimulating the beta 2 in the liver. We know that liver is the seat of metabolism. It is the major organ producing the glucose. So whenever hypoglycemia occurs, beta 2 in the liver is stimulated, it increases the production of glucose. So for increasing the production, it stimulates the glycogenolysis, it stimulates the gluconeogenesis. So when these processes are stimulated, hypoglycemia is reversed. So basically sympathetic system, particularly beta 1 and beta 2, they are protecting from hypoglycemia, one by causing warning symptoms and second by reversing through liver. So that's why beta blockers are very dangerous in a diabetic person. If we give beta blockers to a diabetic person, one thing, person will not have symptoms, second, reversal cannot occur. So beta blockers will stop all the warning symptoms, but only one symptom will not be reversed, and that is sweating. Remember, sweating is sympathetic cholinergic. Sweating is by the acetylcholine receptors, not by the sympathetic receptors. So beta blockers will block beta 1 and beta 2, not the muscarinic receptors. Okay? So sweating is the only reliable symptom of hypoglycemia if a person is taking beta blockers. So beta blocker should not be given to a diabetic. Okay? So these are the important locations and actions of the sympathetic receptor.